Thank you. I'm very honored to be part of this conference on Kundalini research, and I guess we're going right into it. My background is completely different from this field of research. It started like Laurie, like she said, on plasma physics and nuclear fusion and all that kind of good work. But in 1993, I met with Dr. Hiroshi Motoyama, and my life of a Shinto priest and scientist, parapsychologist as well. And my life changed because I decided to go and research in this field. And so that was 1993, and I've been doing research in this field of Kundalini and Biofield research for many years now. And so our approach, my interest is elucidating these energetic phenomena like the Kundalini. And we realize, next slide, please. So what is Psy-Tek first? Psy-Tek is a combination of psychology, spirituality, and technology. So it was founded by Mary Clark, a psychologist and also pranic healer, and her husband, Bob Hertz, who is a computer scientist. Next slide, please. So what we found in this research is that these energies are very subtle. They're called subtle energy because the energies that we're working with are very subtle. If you want to work with the chakra system, what Dr. Motoyama's 60 years of research has shown is that it seems that the energies related to the chakra systems are beyond our measurable instruments right now. So what we have to do is to go and measure the energy fields that are subtle energies that the body actually emits or that we can measure in some ways. And so there's been two definitions or two views of subtle energy. One is small forces that on fields that are known in physics, such as electric, magnetic, gravitational, sound, etc., like the geomagnetic field, body electromagnetic field. For example, the body is extremely sensitive to the geomagnetic field of the Earth. It is so small that, like for example, if you have a compass, you see that the compass aligned with the geomagnetic field, but it's the geomagnetic field itself is very, very small compared to a magnet. And what the body is sensitive for is the fluctuations of the geomagnetic field, which is 1,000th of that geomagnetic field. So the body is exquisitely sensitive. We know that the body is exquisitely sensitive to very small magnetic and other electromagnetic fields of even very low intensity if they are at the right frequencies. So that's one type of energy forces that are called subtle energy. Another one is what not known in physics, but are known in Eastern tradition, just like chi, ki, prana, organ, odic force, etc. So in Western scientific terms, what has been adopted is that the word subtle energy is kind of too vague, and it was adopted that a word that would fit better would be biofield. Next slide, please. So this was actually the NIH as National Center for Complementary and Alternative Medicine created in around year 2000, and it was to explore the healing modalities that are non-standard. And they adopted, the people who were present at the time, adopted the term biofield with a kind of narrow definition at that time, the endogenous complex dynamic electromagnetic field resulting from the superposition of component of electromagnetic field of the organism that is proposed to be involved in self-organization and bioregulation of the organisms. So that was basically an electromagnetic nature. That was in 2002. So, but quickly, research like me in this field, including Beverly Rubik also was part of that, Deepak Chopra and others, we found clearly that this definition is too restrictive. It's been expanded to include quantum physics, and since then there's been some demonstration that life use quantum energies. For example, has been demonstrated that the leaves absorb light through by giving energy to electrons that are distributed, and the energy is distributed through a quantum field into the leaf. We also have microtubules in the brain, the orchestrated objective reduction theory of that has been proposed by a scientist and neuroscientist recently. So we have evidence that the quantum field and quantum theory has to be involved. But we have gone beyond that. We know now that even quantum theory is not sufficient. I just want to point out to Psy-Tek website, we have two white papers there that actually are, one is about the biofield science, current physical perspective, that will give you a lot of details on this. And we have also an overview of biofield devices. It's not only me, but I've been working with other scientists in this field to come up with a kind of a consensus of what we think the situation with the biofield. But what we're approaching here, we're very interested, of course, in the chakras. We're trying to approach the chakras through the biofield, and I'm going to go a little more details into this. So go ahead, the next slide. Just in passing, who is Psy-Tek? We are actually a nonprofit laboratory and research facility. We offer non-invasive health screening assessment to the general public, non-invasive health screening assessment to health practitioners, patients, and what I'm doing is research and testing of frontier devices, products, other modality. And we are on a new problem of energy practitioners testing. So we are a service to the community, and we do energetic assessments. We're not buying into the medical modern system of diseases. I think it's outdated. We have, for example, the Chinese have seen for years and years that a person who has stomach ulcers can have that due from 10 different types of energetic imbalances. And so we need to adjust the treatment to the type of energetic imbalances. So we definitely go through functional and energetic medicine in the future. And researchers like me, I'm not alone. We're having more and more funding to do this type of research. And we have more interest in the medical community. There is now a community of integrative doctors, MDs, that happen every year where they explore all of these things. So things are changing since 1993, since when I started going and researching in this field and feeling a lot isolated. So go to the next slide, please. So, yeah, so we want helping health practitioner and individual to live a better, healthier life and taking responsibility, because ultimately you're the only one dealing with your own energy. And elucidating the nature of subtle energies and how the chakra works is very important for us. We also have a new project that is very, has potentially a very significant social impact. And is that we have, not me, but Melinda Connor and her group has negotiated with insurance companies to provide that if we can provide an objective method of certifying energy practitioners like Reiki, people like Barbara Brennan's system, or others like pranic healing, then they would reimburse their patients. So we're working on that very significant project that will give a lot of credibility, if you will, to energy fields and the biofield in general. And we think that the biofield approach is the most promising one for getting into reversing the present medical scientific paradigm that is obsolete and doesn't work. And now we have the instruments to show that the model is breaking down and that the methods of doing, like, for example, doing pills and just surgery, stuff like that, are only emergency medicine. It's not the medicine that we should use every day. And we have to have an energetic medicine, and we have the patients now to learn how to take care of themselves. And there's no way around it. You cannot have, the model that we had in the 50s and 60s. I go to the doctor, please give me a pill, fix me. I don't want to hear what the problem is. I'll take the pills, and as long as I go well, that's fine. This model is breaking apart. It's not working, and we see that. We're also working on testing water and getting more insight into water. Why? Because the body is 70% water. And there's been new exciting discoveries about water recently at University of Washington. And, there's a book published, I'm blocking the name of the scientist, but it's called The Fourth Phase of Water. It's really worth reading. It gives new insights about the potential of water and why water was used to create life in the first place. Next slide, please. So here are some of the devices that we work with. They are very innovative, based on principles that are not completely accepted in the West, but we know that they are scientifically sound because they've been around for at least 3 or 4 decades and have been testing in different countries, mainly Eastern countries. Like, for example, the GDV, gas discharge visualization, is based on Kirlian photography, and it's basically creating a discharge around the fingers and getting information. I'll get into it a little more. The Multiscan Pro is a very interesting machine also. It's totally Western-based, and it measures body bioimpedance, pulse digital analysis, heart rate variability, all of these things. So we can see that we're focusing on non-invasive measurements because we're not doctors, we're not diagnostic. I just want to make that clear that we're not doing any diagnostic, but we provide an assessment based on certain energy field that we see from the body. Medical thermal imaging, again, thermal imaging is an emission of infrared light that is part of the biofield. We also offer brain mapping. So we're studying the brain in detail. We also a biophoton system where emit light in the visible spectrum. We have also access to the apparatus for meridian identification and invention of Dr. Motoyama in Japan that actually measures the function of the meridians through a very clever way of measuring the resistance of the meridians. So anyway, we have, of course, conventional biofeedback where we measure all kind of skin conductance, muscle tension, all of these things, water testing devices, and we're always open to more to come. Next slide. These are some pictures of the devices I was just describing. Our brain mapping system, by the way, is wireless, and it is dry electrodes, a very new system just being developed the past 5 years. We don't need any paste. We don't need any saline solution or anything. This works very well just by putting the cap on. I used to do, full brain mapping. It takes half an hour to 45 minutes just to get the patient ready. with this machine, 5 minutes, and we're ready to go. Next slide, please. So I just want to talk a little bit about the GDV, electrophotonic imaging, because it's such a novel technique and it gives so much insights into the human body. So please, next slide. So, whoops, click again. So in the GDV, we really, and also the AMI, it's true, we really have the Eastern wisdom meets the Western science. So the Eastern wisdom developed the Meridian system and the chakra system, while in the Western science we have, objective measures of the physical body and the different glands and stuff like that. Now, when we combine the Western and Eastern, we get interesting results. Next slide, please. Here's an example. Dr. Motoyama, the founder of the California Institute for Human Science, a Shinto priest and publisher of more than 100 books on the relationship between, the human energy field, the chakra system, and enlightenment or emancipation or, the Kundalini process. In fact, I remember that we were invited, actually, Dr. Motoyama was invited by Bonnie Greenwell about 15, 20 years ago to present at her Kundalini Research Network at the time about our Dr. Motoyama's research in the Meridian system in the Kundalini chakra. So Dr. Motoyama was able to map a correlation between the chakras, organ tissues, and meridians. And that is very important to us because we have ways to measure the Meridian system. We have two of them. We have the GDV and we have the AMI, but we don't have anything to measure the chakra. So the idea here is that by correlating the function of each of the meridians with their corresponding chakras, we might have an insight about the function of these chakras. The idea is that the chakras are very subtle systems of energy that actually have the ability to pour energy into the meridian system and make a person a lot healthier, or by not pouring energy into the system, the meridian system, make the person sick. These chakras also are corresponding emotional contents, each one of them, like Laura was talking about, and in mental contents. So Laura mentioned a little bit both of that. We totally are in alignment with what Laura said about the 7 chakras here in our research. Next slide, please. So the GDV was created by Dr. Korotkov, and it's based a kind of Kirlian photography. It's kind of aura photography, and it's in itself, it just gives a nice glow around the finger. It's like it comes from the Kirlian's photography original research, which was with leaves, the phantom leaf effect. They put a leaf on a photographic plate and put a high potential on it, and there was a glow around the leaf. They cut a piece of the leaf and they saw the glow of the entire leaf. So that was one of the first insights into the existence of some subtle energies. Since then, Dr. Korotkov has worked with the Kirlians, and we don't hear that in the West, but Dr. Korotkov himself saw that the Kirlians had a huge grants from the government to do research in what they call electrophotography, and Dr. Korotkov come up with the GDV, an amazing machine. So let's go to the next slide, please. So this is the phantom leaf effect. As you can see, we look at a whole leaf, but actually the top part of the leaf is the phantom region. There's no leaf there at all. Yet the glow is very, very clear. And there's a paper published by John Hubacker. And if you are interested in knowing more about this, this paper is very interesting. It was published in the Journal of Alternative and Complementary Medicine about 3-4 years ago. Next slide. Keep going. So this is what the GDV does. You have here a finger, and a glow is generated around. It's divided in sectors and color coded for clarity of sight, and then put around the person and give an aura field. Next slide, please. So we're looking at two things, vitality and symmetry. Next. So you can see on the left a person with many holes in the field. So that person would have issues of low energy in some organs that corresponding to these holes, versus a very healthy person on the right side. And these holes also, you would see that on what we see the left side is actually the right side of the person. You would see there's more energy on one side than the other, and that also indicates something on imbalance in the function of the chakras. Next slide, please. So we can see here, for example, this is an example of the energy of each organ compared to a standard, which is the green region, deficiency in the pink region, and excess in the yellow region. Next slide, please. And here is what happened to the chakra. This is an example of a person with some energy imbalances. On the left side, anything that is outside of the green region is completely considered imbalanced. And you can see also that the chakras are different size. So we're able, through measuring Kirlian photography, the energy, we're able to measure the energy in the corresponding body system and organs, and translate that into a corresponding energy or activity of the chakras. When the balls are bigger, that means the chakras are more activity. When the balls are small, there's very little activities in those chakras. When the balls are misplaced, left or right, so that means that the chakra gives a lot of energy on one side and not in the other side. So it's a huge imbalance. So indicates also blockage of energy. And you can see after pranic healing treatment of 1 hour, all the energy are aligned. By the way, people normally are looking more like what we see on the left side. When I see someone, from time to time, actually relatively often because of the where I'm located, CIHS is on the campus of the California Institute for Human Science, a very progressive school where we're open to all ideas. We see a lot of people with spiritual practice. But when I see someone with chakra aligned, like on the right side, I know I immediately ask a question. Do you have some kind of a spiritual practice? Do you practice yoga, meditation, or something? Oh, yeah, I do Tai Chi. Or invariably, they have some kind of a spiritual practice. So we can see that meditation and spiritual practice are very helpful and useful in helping balance the chakras. And it could be from many different traditions, actually. Yoga, energy healing, Tai Chi, Qigong, just meditation also. All of these things have a big impact on our energy field. And here's what's important about these machines. Why am I so interested in these machines? Exactly for the reason that was raised by the other speakers. The medical system and the science in the West does not understand this phenomenon. And over the years working with Dr. Mutiyama, I've seen hundreds of cases, not as many as Bonnie, but we've seen hundreds of cases of people who are imbalanced and have Kundalini awakening. I myself had to be helped with Dr. Mutiyama about this. And Dr. Mutiyama was able, in my presence, to help people get out of crisis by giving advice. First, he was able to work on their energy as a healer himself. Second, he was giving them some spiritual practice to help them go through this, and it's very effective. So we can see with this machine, whatever a person does, works or doesn't work. And it's not only about, like Kundalini awakening. Also, we had a person with breast cancer metastasized in the spine, very serious case. And this person was, we work with her with pranic healers, with a diet, changing location, which was toxic for her. And it took about 5 years, but she finally healed from that. So, and also she had to work mentally, because we can see with the GDV whether the problem is due to a physical condition alone or a psychospiritual condition. That's a very unique machine that can do that. So we're very, very excited to be working with this machine. Next stage, next slide. So we also, I just want to mention briefly, because time is flying, we have a test suite for energy practitioners that we are working with for them to be tested and be certified, so that we need to build about 10, to measure about 10,000 people in all the 50 states before the insurance company will be willing to insure. But we are actually have 1,000 measured already. Please, next slide. Yeah, these are the devices. You see the GDV is part of it. We measure also, we ask also people to generate electricity. It seems difficult, but most energy healers are able to generate electricity with their hands. They're also able to modulate a magnetic field. We can also measure how the chakras influence, the electromagnetic field around their body. For example, we have Wi-Fi around us. It interferes with our field, and we have machines there that can measure that. So I don't have time to go into that in more detail, but I think this is very significant, potentially to help legitimate the field of bioenergy healing. Next slide, please. So here are the equipment lists. We have a Gauss meter. We measure magnetic field. We measure a multimeter that measures electric field, both AC and DC. The RF meter, we measure radio frequency. We have the GDV. We even ask them to change pH. We found that most energy practitioners that are really working daily and have very effective can change pH of water. And we have a broadcast analog frequency counter, and we found that the chakras, when we are right close to the chakra, it does a frequency shift to the Wi-Fi around them, which is interesting. And it's a test we can do today because there are Wi-Fi all over. Otherwise, we would probably not. But it shows that our energy field interact definitely with the electromagnetic field around us. Next slide, please. So this is the AMI. How am I doing time-wise? 1:34. And let me see. So I guess I'm going to just glide very quickly on this one. So next slide,
You're doing
please.
good, Gaetan. We have you down till 1:37, so you can get your full 30 minutes.
Okay. So just time to go to Dr. Mutuyama's AMI apparatus quickly. So next slide. So this is the AMI. It's very different from the GDV. We put little pads, which are called active electrode here. The little square, we put that on the tip of fingers and toes, where are the Jingwell points. We have the big electrodes, which are like EKG type electrodes. Then we put on the wrist, these are ground electrodes. I think I have a slide on that. Next page, please. Next slide. Okay. It's invented by Dr. Mutuyama in the 70s and measure parameter related to chi flow. And we can do snapshot, actually, that's snapshot measurement or continuous measurements. That's the nice thing that is different from the GDV. We can see change in the flow of chi in the meridians in real time with this machine. Next slide, please. So this is the points that are used. 12 standard meridians are used, plus 2 extra meridian, the diaphragm and the stomach branch. These are the Japanese system of meridian. Next slide, please. And what it does, the AMI, very quickly, it sends a pulse of 3 volts that lasts half a millisecond and does a measurement where it measures the flow of chi, it measures the stress level of the corresponding organ, and the immune function. All three parameters there. Next slide, please. And you can see, so BP, tell us about the chi. And next slide, please. The AP, which is at the end of the curve, tell us about the autonomic nervous system. And the next slide, please. And the IQ is the integral electric charge accumulated under the electrodes and has information about the immune function. All of this information are published in books. If you are interested, you can contact me. You can get more information. Next slide, please. So this is the kind of evaluation that the EMI does. Measure left-right imbalance. I also use the notion of Chinese medicine of inversion, because the organs should have certain energy flow in a certain direction, and sometimes it changed slight. And you notice that there's a chakra type there, and that person is Vishuddhi and Manipura 1. So Dr. Mutiyama used the table that I showed you before to infer the activity of the chakras. So the EMI is the original device that actually is doing measurements of the chakras, and the GDV after that, Dr. Korotkov adapted this knowledge for the GDV, and it actually, in his book, he acknowledged that this comes from Dr. Mutiyama. So the nice thing, so next slide, please. So we have radial charts also that's showing for each of the organs if you have excess or deficiencies. Next slide, please. And you can see at the bottom of this one, you have the activity of the chakra, which is measured by imbalances, excess, deficiencies, slightly slightly different from the GDV. I just want to mention also that as scientists, we cross-correlate references from all machines when we can. For example, we found out that for the organs where the GDV and the AMI have the same organs, because the GDV has way more organs than the AMI, the correlation is 100% in our last project. So this is very exciting because we have machines that measures with the function of the flow of chi in very different manners and come with the same conclusion. So this is very significant. Next slide, please. This is for the setup for the continuous measurement mode. Next slide, please. Yes, we can go to the next slide. And this is what happened with the continuous measurement. At the top, so it takes about 10 minutes at the top of the curve to see that. It takes about 10 minutes for all the meridians to stabilize. And then at the bottom graph, you see that there's a needle inserted into the associated point of the heart constrictor meridian, and it took about 10 minutes for a reaction to happen. And if you consult an acupuncturist, they like to leave the acupuncture needle for about 15 minutes because they know intuitively that it takes some time for the acupuncture needles to do their work. Next slide, please. And I believe that is my presentation. I just want to say that we have now technology that convincingly measure some parameters related to function of meridian for sure, and certainly chakras. So far, what we've seen empirically is very, very exciting because we can now have a paradigm, which is the biofield, where we can expand scientific research into the fields of meridian research, biofield, and chakra. And we can see, now that the people who say that they have a chakra awakening, we can see the effect it has on not only on their physiology, but on their body energy and even their psychology. So thank you for having me. Here's my contact information. That's our phone number. We are in Encinitas, California, and we have the website here, psytech.com, psy-tek.com. And if you want to send us an email, it's at info@psy-tek.com. Thank you for listening.